So our next speaker is Dr. Rajul Parikh. He's going to give us. We have this talk specially because this is a national symposium, and we thought we should give the due recognition for the GSI guidelines. GSI has formed the guidelines for all the comprehensive ophthalmologists and also the glaucoma practitioners. We have the guidelines we are going to distribute here in the pen drive, and people behind framing these guidelines were Dr. Chandrima Paul and Dr. Rajul Parikh. So now I invite Dr. Rajul Parikh to update us what this guidelines consist of and how it's going to be useful to all of us.
Yeah, thanks, Amit. So in 8 minutes, I'll just try to cover the basic concept of the guideline. So me, Venkatesh, and Kavita with editor, and I would say Chandrima and Dr. Pandav, they were very helpful and they didn't interfere at all during the making the guidelines. And we have, these are the chapters. We had chairs, co-chairs, and more than 70 authors. Some of all the glaucoma specialists, Indian glaucoma specialists sitting here, I contributed to some extent. The objective was that we wanted guideline to be specific to the India subcontinent, should be simple, and should be useful for the general ophthalmologist. Of course, glaucoma specialists do not require this guideline, but it should be more specific to the general ophthalmologist. At the same time, there we have lots of guidelines, EGS guideline, we have ASHAP Pacific guidelines, and all are evidence-based. So we also wanted to be evidence-based. At the same time, we wanted to keep some basic chapters which are not in EGS to be useful for the general ophthalmologist. We wanted to cover the secondary glaucomas in more detail, which is not available in some of the guidelines. And of course, Indian subcontinent, we have huge angle closure disease, so we wanted to be more specific to be angle closure. And at the same time, we didn't mind borrowing some from the European Glaucoma Society and WGA consensus guideline. We adopted some of them directly rather than complicating the things. So see, management goal we know. So and the same principle we try to apply that. So what we did that every chapters also have a concise 15-20 points to be specifically for each chapters. Like for assessment, if people don't want to read and just go through these points, they can understand that what is the important points. So like assessment, very clearly mentioned Goldman apprehension torometry is gold standard. Corneal thickness underestimate, overestimate, but at the same time, written very clearly that do not use nomograms. So gonioscopy is important. Like that, every chapter has a outline, the most important points of the chapter. Same, then we had a risk factor and management principles chapter separately, where we talked about POAG, PSEG risk factor and how to manage. We have taken this from the EGS very simply, and we have acknowledged them. So it was a very nice flow chart in EGS. The target IOP also we borrowed from EGS, which is very simple. So rather than complicated, we just borrowed from EGS that if there is early glaucoma, short lifespan, IOP is high, then you can go for the higher target IOP. So make it simple, use whatever is available, and give a good guideline to the general ophthalmologist. We have surgical options. We had kept the basic surgical part also, though it's not required from the guideline point of view. But since it was a first edition, we wanted to cover general ophthalmologists. So we talked about the basics of surgical technique and complications. Though in second edition we can remove it. This was first edition, so I kept it. Options. Then medical management. We again this is borrowed from EGS. That how you should start treatment, when you should add, how you should follow up the patients. We have covered how they work the drugs, what are the therapeutic effect of each drug, and follow up. This protocol, this is a specific, we incorporated that if the patient is early glaucoma, stable, then how frequently you can follow up the patient, how frequently you should do the visual field. Again, this is from the EGS. We have just adopted that because it's a very good first 5-6 field in first 2 years, then you can make it yearly. And we also given guideline that if the patient is progressing, then how frequently you should be more aggressive. Adherence issues we have covered. Then we have summarized. As I said that every point, every chapter is a good summary. Then though normal tension glaucoma is a spectrum of POAG, you require specific consideration and we have tried to cover that in a separate chapter of normal tension glaucoma. PSCD, as I said, is very close to all the Indian glaucoma specialists had because it's very a big issue. We have tried to cover PACD in a more detail, uh, in more detail. Then at the beginning, this is something was not given. It's that do's and don'ts of diagnosis and management. So if you read this, the basic thing, first 3-4 pages, you get a whole crux of the management part. Like in do's, take detailed history. The asking patient's family history of glaucoma is very important. Asking systemic disease, systemic medication, because lots of things have a relation with glaucoma. Only Goldman, multiple IOP, do CCT, do gonioscopy in every patient, POH is diagnosis of exclusion, always to dilated disc examination. At the same time, don't underestimate, no shiots, no corneal CCT corrected nomograms, no von Erich for anger closure, no for ASOCT. So we have tried to cover do's and don'ts. So if you read these first 3-4 pages, you get a crux that how you should manage the glaucoma. Though of course reading the book is more important because it gives a more detailed explanation of each part of the spectrum of the disease and diagnosis and management. So like for that, always use parametry, be reliable, normative. It's very important because now you have lots of machines which do not have normative database. So very few machines have a good normative database for diagnosis and progression. So use that. Always correlate disc and field. Some of the talks already has covered this, but I'm just giving the guide, what we have tried to cover in the guideline. Imaging, then always base progression based on trend and event analysis. Then don't know for imaging. This is very important. Know for the imaging for screening and random diagnosis is very important. You get all the red and green disease. So we have tried to cover each aspect of the glaucoma in a guideline. Um, Again, from the management point also, I don't want to go in detail. I just wanted to brief that what you have tried to cover. Uh, Medical management, surgical management, diagnosis, everything has been covered. The Amit has already said that he's going to give the pen drive, but now it's available on the website also. So if you go to glaucomasociety.in, you can download the PDF file very easily. Oh. So Venkatesh is saying that it's already given. And if there's any issue getting the guideline, you can contact me. I will not mind giving you my the PDF version is there. Thank you.